Live from the Carl Chevrolet Studios in West Des Moines, this is Iowa Live.
Welcome back to the program, everybody. Well, you do realize that right now the annual Medicare Open Enrollment period is running through December the 7th. There's no way you can turn the TV on and not know about that. So how about we give you a little bit of assistance of what programs are available out there. Kari Webber from Physicians Mutual is here to join us. And this is really an important period. You really need to pay attention. Kari, first of all, welcome.
Thank you for having me, Lou. You are exactly right. So it's Medicare Open Enrollment. Lots of advertising, lots of phone calls, lots of outreach to those who are covered by Medicare currently. So it's that particular time of year where if you are enrolled in Medicare, you can make changes to your plan. Now, it's important to realize that if you are enrolled in Medicare and you're happy with your coverage, there's nothing you need to do.
You don't need to do anything.
No,
okay.
You should never feel pressured to make a change during this time.
Because some people do. When they get the phone calls, they think, oh, I need to change. You don't need to change if you're happy. But
absolutely.
What if you're not happy? What if there's something that's missing in the plan that you selected?
Well, this is your time, right? So this is your time, the October 15th through December 7th. So, for example, say you have a Medicare Advantage plan, and perhaps something has changed in your provider network, or you want to explore Medicare Supplement and that coverage and what that's all about. Prescription drugs, that's a big one, right? Our prescriptions change for us during the year.
And the plans change every year.
Yes, and so particularly for Part D, you know, take a look at your prescription drug coverage and make sure that plan still works for you with your drugs that you are prescribed.
Now, what if somebody out there is watching right now and they say, well, how do I know if these all change? Do I get notices about this? Is there something where you can assist them in taking a look at what they have?
That's where, yes, it can become very overwhelming, right? And so I think first it is familiarizing yourself with the Medicare program. You know, a lot of it is, it's overwhelming, it's confusing. But why is that? You know, we only retire once. We've never needed to know this information before. And so the good news is it doesn't have to be confusing. You know, Physicians Mutual has been helping people understand the Medicare program since the inception of the Medicare program. And so, yeah. So it's even knowing those basics, if you will, like, you know, Medicare doesn't cover everything.
Right.
It covers 80%, roughly 80%, and so you have that 20% gap. It also doesn't cover dental. And so we have folks, you know, contacting us a lot about, you know, whether it's a Medicare supplement opportunity or a dental policy.
That's part, you can add that, right? Because you mentioned the dental, which is really important to a lot of people. They may not have realized that it doesn't cover that, but you can help them get that supplied.
That's right. That's right. And becoming more familiar with the program just helps you become more confident and knowing that you are covered in retirement, and so that you can maybe drown out a little bit of the noise that's coming your way just with your confidence and surety, and have a little more joy as you have your health and retirement.
But you need to do this. You need to make these changes before December 7th. That is the deadline. It really is a deadline, right?
That's right.
Yeah. Now, what if somebody is just about to retire? There's a lot of people just coming upon retirement. What advice do you have for them? Because they've never dealt with Medicare like this at all.
That's right. The magical age of 65.
That's right.
We all can't wait, hopefully.
Yes.
But yeah, there's a different enrollment period for those who are approaching retirement. And that is 3 months before and 3 months after when you turn 65.
All right.
You turn 65.
Okay.
Yep.
So say if your birthday's in November, you have like a 6-month window, 3 prior, 3 after.
That's right.
Right. And what advice would you give them before they get to that mark?
I think it's the same. You know, we always recommend, you know, at least 6 months out, start familiarizing yourself with the Medicare program. Again, it can be very confusing, overwhelming. People want to put it off because they're not confident about it. But get that trusted advisor and get your education about so you feel confident.
Trusted advisor, maybe somebody who's been in the business for over 100 years?
That might help.
How many years has Physicians Mutual been around?
Yes, over 120.
Wow.
It's amazing.
That is impressive. Yeah. And if you want to get more information on things that we talked about here today, what's the easiest thing that they can do? Because that sounds pretty simple.
Yeah, physiciansmutual.com. That's where you can find us.
Yeah, and do we know how many different plans there are being offered right now, or is it more than you can count?
Well, yeah, we are primarily Medicare Supplement, dental, life, and then we just added pet insurance.
Yep.
So that's been a fun ad for us.
A lot of different things. Again, check out the website, physiciansmutual.com, to get all your questions answered. Kari, great information here today. And just remember, the open enrollment period is now through December the 7th. Thank you so much for being here.
Thanks so much, Lou.
Thank you so much for spending a little bit of your time with us today, and we'll see you back here tomorrow on Iowa Live.